afternoon, everybody. Year-round on Positively Tampa Bay, we bring you information on community events to help keep you healthy and safe. Well, today we're turning our attention on a number of heart screenings that Florida Hospital Pepin Heart Institute will host this month. Take a look this Friday and again on September the 26th. They're hosting heart screenings at their Pepin Heart Institute campus on Fletcher Avenue. The screenings include a handful of tests followed by an evaluation with one of their heart professionals. And then take a look. This is what's going on at their location in Brandon at 426 West Brandon Boulevard. The first one is this Thursday, and then the next screening will happen on September the 27th at that location. There is a $25 fee to participate in the screenings. However, you do need to register ahead of time, and they will be waiting for you. We welcome to our studios Dr. Charles Lambert, who is the medical director at Florida Hospital, also a cardiologist by trade. How are you?
I'm great.
Thank you for coming in. I always ask the same question for everybody who's stressed out. Not that I am. But how does stress play a part in your heart health? I know it's something that you talk to patients quite a bit about.
Yeah, I mean, we always used to say stress, causes something, not sure what. Stress is actually an independent risk factor for cardiovascular disease. It's been shown in a whole bunch of different situations, some strange like earthquakes and earthly events, but just stress in your normal daily life can cause cardiovascular disease or make it worse.
What are the different tests that are done during these screenings, and which ones would you say are the most important ones?
Well, they're all important. I mean, you come to one of our screenings, people will look at you and they'll talk to you. We'll take some numbers. We'll measure your cholesterol, measure your glucose. Diabetes is a big risk factor. Look at your heart rate and do your BMI, kind of a normalized body mass index thing. Really as a function of weight, but if you're a big person versus a small person, it normalizes that. And we'll do a test to screen for peripheral vascular disease.
So many folks say, I feel fine, I'm sure there's nothing wrong, I don't have time to go to the doctor. What happens at these health screenings? Do you see more women coming in just in case, and then they find out they have more than they expected?
Well, we would like to see more women. I mean, it's the leading cause of death for women in the United States and in just about every industrialized country in the world. Women don't have a lot of symptoms, unlike men. Men have a problem with denial. Women don't get screened. A lot of their physicians under-test women. So it'd be nice to have a plethora of women coming in for screening.
How many folks are you hoping to have at the end of all of these 4 screenings that you'll do?
We hope to have a couple thousand.
Wonderful. And is there anything that they, folks who choose to participate, that they need to do ahead of time on the day of the screening?
Just get up and walk in. That's all they really need to do.
Should they fast?
It'd be nice if they fast, but they don't absolutely have to fast.
Is there information that they should have in terms of their family history for heart health?
Family history is good, their own medical history, their medication history, but other than that, the measurements are objective and they'll be done on the spot.
And then the last question I have for us folks who are always in a hurry, how long would you say it takes from beginning to end?
Probably a half an hour.
Wonderful. Well, thank you, Dr. Lambert. It's always so good to see you.
A pleasure.
If you would like more information on these heart screenings that happen, take a look on your screen. This is happening at Florida Hospital's Pepin Heart Institute, 2 locations in Tampa and Brandon. There are the dates, September 19-20, September the 26th, and the 27th. For the details, visit floridahospital.com.